Thank you all so much for joining us here this evening. It is my honor tonight to facilitate a panel of some amazingly smart, passionate people who have been working tirelessly 7 days a week, what sometimes seems like 24 hours a day, in the interest of the public good. A lot of work has been happening behind the scenes, and I'm really excited to share the results of some of that work tonight. I often liken county government to the metaphor of a duck. So it looks like it's just kind of sailing across the surface very smoothly, but underneath it's paddling like hell. And that's exactly what we've been doing in the midst of this pandemic, is paddling and working hard to develop some tools that will help our economy reopen for business. Spoiler alert, this panel is not going to tell you when Sonoma County will fully reopen for business. That decision lies in the expert hands of our public health officer, Dr. Sundari Mace. But the goal tonight is to share a framework for how we will open for business in partnership with small business owners, labor, employees, industry leaders, chambers of commerce, and other membership organizations, all under the guidance of our Health Services Department. I want you to know that everyone on this panel is committed to a data-driven, science-based approach to reopening that protects employees, customers, clients, employers, and the broader health of our community. It's important to recognize that early aggressive action by our public health officer saved lives, and the sacrifices made by Sonoma County residents have really flattened the curve here locally with respect to the spread of COVID-19. However, I also want to acknowledge that those sacrifices and those early aggressive actions have come at financial costs to many of our residents. And so the good news is that that early aggressive action bought us time to develop strategies to protect the public health. We've been able to ramp up testing. We've been able to train a workforce of medical professionals tasked with contact investigation. And so we are starting to get to that time where we can enter a new phase, one in which the economy is no longer pitted against public health, because we're not just looking at a holistic shutdown, but working in sync with public health. And this is one where commerce hopefully can take place with protocols and safety measures that will protect our community. And with that, I would like to turn it over to my colleague on the Board of Supervisors, Supervisor Rabbitt, who has been working very closely with me on issues of business and community support.
Well, thank you, Supervisor Hopkins, and thank you for allowing me to be part of this discussion this evening. And thank you for the continued collaboration with everyone here. There have been dozens and dozens of phone calls, Zoom calls, conference calls with as many Sonoma County business owners, the different associations, the chambers, the trade groups, the individuals, and other electeds as well, to really discuss that impact and discuss how best to move forward. And like you said, a ton of that work is happening behind the scenes. Those conversations sometimes become very intense. This is, I mean, obviously the health aspects are incredibly serious, but so are the business aspects. And we're really trying to balance the two. Public health is the priority. We've been successful to date. The needs of the individuals to earn a living, though, put food on the table and keep a roof over their head is important as well. And I got to say, what continues to impress me is the collaborative nature of these discussions. So the businesses and the individuals really do understand the health consequences. And while they really desire and wish everything to be open as soon as possible, they also understand that we need to do that in a very responsible way that does not endanger public health. I very much appreciate that. It's convinced me too that business is up to the challenge going forward, and it won't look like business as usual for quite some time. But businesses are willing to adapt. Quite frankly, they have to. And it's going to be our behaviors that keep us safe going forward. So again, I appreciate the opportunity to talk about that horizon that we really want to reach with cautious optimism. Our county has done, like you said, a great job thus far on the health side. We need to continue to keep that up, to not sacrifice any of that. But at the same time, we need to make sure that people who have been without a paycheck now for going on 7 weeks can soon get back to work and can soon earn a living for their family. So again, thank you for the opportunity to be here with you.
Thank you so much, David. And if anyone doesn't know, I love working with David because we are fellow data geeks on the board. And so we are always asking for explain the why, explain the numbers. And so we've been doing a lot of learning, I think, over the past few weeks regarding, things we never thought that we would be learning. With that, I would love to hand it over to Dr. Jason Cunningham, who is the CEO of West County Health Centers and longtime Chief Medical Officer from West County Health Centers before he took the reins from the beloved Mary Seychelles out in my neck of the woods. Thank you.
Thank you, Supervisor Hopkins. And I have to say, I didn't know you were a data geek, so I know a little bit more why we're aligned. But this to me is a really nice opportunity to talk and to spend time on this complex issue. And so I'm thankful for it. A lot of times in our organization, we do a little exercise of gratitude when we're starting, and I think this is appropriate to do that. I think we are sitting at a time right now of success that we have over the last 6 or 7 weeks really made a difference in flattening the curve, and it's saved lives. And I think we don't oftentimes step back and reflect on that in the middle of it. And I think that's worth doing. And I think a couple other worthwhile statements of gratitude deserve to be said again. And you said it earlier. I think Dr. Mace deserves a call out, stepping into a new community after doing many, many years of work in the public health field and deciding to take this on. Doing that early on, deciding to take decisive action has saved lives. And I think for somebody who's dedicated her life to public health, that must feel really good. And I think that her children should look back and say, my mom did that, and that was an important part of it. And I would also say that that's difficult and that it was complex and it will continue to be complex. And so that we should lift that up as somebody who's made a decision to move forward with honesty and integrity. And then I'd also like to say that leadership is difficult. Lynda, I'd like to call that out for you. You and I have worked in the past. I'm Supervisor Rabbitt. We will work more in the future, but I've really had an experience with you, Supervisor Hopkins, just recognizing and calling out that there is an authenticity in your work and also a willingness to kind of go head on some of these things. And I appreciate that. So this is an example of that. This is not a right or wrong. This is trying to figure out how to go forward with good intent. And then healthcare broadly. I think that many of us, even 4 weeks ago, were planning on what it would be like to make decisions around who gets a ventilator and who doesn't, to really look at an overwhelm. And we're sitting right now celebrating that we only had 2 people who passed directly related to this. And I think we should celebrate everybody from the first responders to the respiratory therapists to the frontline primary care providers and medical assistants, ER docs, and staff. And I think that's worth celebrating. Going back. But I think you mentioned it, which I think I'd like to just put an exclamation point on. We've missed a narrative, I think, on the impact that the community collective action has had for this. And although the decisions and leadership and healthcare impact is important, I think that we need to look back on this 30 or 40 years from now and celebrate that we as a community leaned in this and really made a difference. That it really was not just taking orders, but taking this on collectively to make a difference. And I think that's worth saying, that the high school senior who didn't get to go to their prom, those who were mourning without others around them, their lost loved ones, the economic impact, the socialization, all those things that we've suffered through haven't just been because we took orders, but because we chose to do that. And we should then also make sure that we're celebrating that as a community and collective impact. And I want to put an exclamation point on that, because that's what it's going to take moving forward safely, is that this becomes an us issue, just like we did in all the fires and the flood in Guerneville in 2019. We need to make sure that we take this on as collective action. So I wanted to say that. And then the last thing before I get into some specifics, I'd like to undermine a narrative that I think I've been seeing out there, that in some way that this is a discord between the economic players and the healthcare players. And I have not seen any part of that to be true. In fact, I've seen the opposite, that I've really seen those who are making decisions from a leadership around business trying to do the right thing. They're trying to figure out a way to do this safely. And so I just want to make sure that I undermine my experience has not been that as the case. So, and then lastly, from a approach here, I think that I'd like to call out that it isn't just the COVID-19 we're talking about, it's these echo diseases, or people have been calling it, or the diseases of isolation that have really been an impact. So things like mental illness, suicidality, things like isolation. I treat patients with substance use. I've seen an increase in that. I've seen an increase in people who are really struggling and suffering with of depression, anxiety that are serious. I've seen a concern that we have that there's been less CPS referrals this year than last year. And that means that we're not overseeing the most vulnerable in our community. Domestic violence, all those things that we know thrive in isolation, we need to make sure that we're being sober about and taking that on. So not that that needs to drive our decisions, but that absolutely needs to be part of our decisions and how we look at the impact of this disease, and also how we make sure that we're really responding to the next phase in this. So because of that, and because of somebody who's dedicated my life to the vulnerable, the most vulnerable in our community, in primary care, I'm actually convicted that this isn't just we need to walk forward, we really need to move forward into the next phase. And I think that's because of the more broader impact. When you take a bigger lens of disease, we need to make sure that we're taking on the decision, just like we did in that first phase, to say, how can we do this? Not because it's the next thing, but it's because it's the right thing to do, and make sure we're doing that in a very careful, with innovation, with support, with oversight, but make sure we're moving forward to that from a healthcare perspective. So the prerequisites that we talked about in order to go safely from phase 1 to phase 2, I think are worth saying. And the first one is that we need to have testing. And so we can't go forward without an acknowledgement that there will be new cases, and that we need to make sure that we're tracking that and isolating those. And so Dr. Mace has said it clearly, we need around 600 or 800 test capacity per day. The federally qualified health centers have capacity for about 200 per day. The Department of Health Services has about 250 per day. There's 2 test sites that are being pulled up that have about 150 per day. St. Joseph, Sutter, and Kaiser have internal labs. So we have that. Quest and LabCorp have availability. UCSF has capacity. We have now swabs. So we need to make sure that we're using that effectively, coordinating that effectively. But even as of a week and a half ago, I wouldn't have said that that's true. Right now, I feel more comfortable that we can move forward confidently in that. Number 2, we need to make sure we're tracking the status of people. So if they're symptomatic, we need to make sure that we quickly identify them and make sure that they're safe at home and that they're not infecting others, and that we're contact tracing around that. So putting systems in place and it's enhancing our systems in place to make sure that that's safe. We need to make sure that we have markers for those echo diseases, that we need to make sure that we're actually seeing what's happening around suicidality. We're seeing what's happening around mental illness, that we're seeing what's happening around domestic violence and other of these vulnerabilities moving forward. And that we need to make sure our medical facilities have capacity to move forward. So I think those things are checked off. We need to make sure that we're doing this in a way that's sober, in a way that is thoughtful, that the way is measured. But I think we should feel confident that our systems are generally in place for us to move forward to this next phase. And so then to turn it over to Sheba, just to say, I think that we, moving forward, need to do this in such a way that is serious. We're taking this seriously, that we're not assuming that this is not a real disease, not that this is somehow not important, that we need to take that on seriously, and that that we need to make sure that we're talking about this next phase in a way that the community can get behind, not just about what the orders are coming down. So we need to all be part of the solution as a community collective action, which means we need to understand why decisions are being made, make sure that they're transparent in those decisions, make sure we understand the process of safety moving forward. So I'll stop there and just thank you for the opportunity to participate in this discussion.
Thank you so much for joining us, Dr. Cunningham. And I apologize, I actually should have gone through the full Brady Bunch screen before turning it over to you. But I also wanted to let everyone know that our fantastic Executive Director of the Economic Development Board, Sheba Person-Whitley, is here, as well as Santa Rosa Metro Chamber of Commerce CEO, Peter Rumble. And I just want to say, I feel so lucky to be able to work with Sheba. And it was truly my honor to be part of the Board of Supervisors that hired such a fantastic person who comes in with a vision and a passion and has been working tirelessly in what seems like a permanent disaster mode ever since she has joined in her role at Sonoma County. So I would love to hear from you, Sheba, what you have been up to and what the plan going forward is for working with the business community and the labor community towards reopening.
Yes, thank you so much, Supervisor Hopkins and Supervisor Rabbitt, for having me today. And to the other panelists, thank you. So yes, Sheba Person-Whitley, EDB, been here almost a year. So it definitely has been a lot that has happened, but I'm accustomed to it, having lived in Louisiana, which, and on the East Coast, lots of disasters, but happy to be here. We certainly recognize, to Dr. Cunningham's point, that we have multiple crises, right? We have economic and we have health. And then there are also some other community indicators that that our partners at the Department of Health are tracking. You should probably see a dashboard probably tomorrow or Tuesday at the latest that speaks to some of what you're talking about. Some of those other indicators dealing with isolation and dealing with mental health and dealing with food access and all the different things that people are experiencing within our community. So look for that. In addition, the dashboard would also speak to those parameters that the governor talked about 2 weeks ago, those parameters that he expected all communities to be able to meet, and where we are as Sonoma County and how close we are to truly achieving those. And so that dashboard will probably go up tomorrow. I do agree 100%. There really needs to be an elevation of the transparency to show how much good work is happening, because if people don't know about it, it's just as if it didn't happen, just because of lack of awareness. So what we've been doing outside of, working with our partners over in health is working with the chambers. We're working with labor, as Supervisor Hopkins said. We're working with industry leaders all across many different sectors, economic development professionals, as well as business services professionals. We are doing daily calls, pulling all the resources and information together. We recognize that a great deal of work and effort has gone into thinking about reopening. How do you position yourself as an industry and as individual businesses to get there, to get ready? And this is the time. Absolutely, we recognize it as an urgent matter, and we need to be bold, and we need to be innovative and creative, and we do need to lean in, absolutely. So we do have a recovery task force that is going to be getting at some of those best management practices that Supervisor Hopkins has really elevated and spoken about over the last several weeks. One of the things that we're missing from that is really knowing from the public health officer and our partners at the Department of Health what mitigation measures businesses are going to need to undertake. So a lot of the planning that has gone on through the Metro Chamber, through Hillsburg, to the Santa Rosa, Vintners, others, they've all been doing a lot of planning. But what they were missing is directly from health. Okay, what are the mitigation measures, and how do I think about those things proactively? How do I use this time to ramp up to secure PPE? What are the requirements going to be, and how do I think about how I operationalize that? It's not the government's position or business to tell them how to do that type of work, but really just to provide the high level standards that people are going to be required to meet in order to build consumer confidence as well as employee confidence. As people enter back into the workforce, they need to understand that their employer, their bosses, their director of operations have put the things in place to provide for a safe working environment and also to protect the consumers and the patrons. So we have 100% confidence that our savvy business community is absolutely up for the challenge. We know that there's a great deal of work that has transpired to date. And so we're going to pull all that together into a set of very easy to understand best management practices. We're not going to develop it. Our partners throughout the community, industry leaders, are going to develop it, but then we will be able to put that into a repository that everyone can access it. So if I have a particular type of operations, I know basically these are the things that I need to be committed to do in order to provide an environment that everyone is comfortable and confident coming back into. So we're working very, very diligently on that. I did just speak about the dashboard. I do think it's really important that everyone understand how much work has gone on and how close we are. We do anticipate, we've been hearing over the last several days, that it's likely that the governor is going to be moving very quickly to start to reopen some economic activities. And so we want to make sure that we are positioned well to take advantage of that and be nimble and really lean into it. I also want to acknowledge that the reason why we are so close, right, and the reason why we're continuing to see some alterations with regard to certain types of business operations that are coming back online as the shelter-in-place orders have changed, is because we've all done such a great job with sheltering in place and with flattening the curve. And that is what has positioned us to be right where we are now. And we are so far ahead of so many other communities. And so I just want to say that this is certainly a collaborative effort. Everyone has done their part and chipped in, and I know that they are exhausted and they are tired and frustrated and scared. But we are right here with them. We want to be here to support, to get people to where they need to be and make sure that we can move as quickly and as safely as possible to get people back to business. So with that, I will just acknowledge that this is definitely a collaborative effort. We have gotten here because of all the work that many of my partners across the county have done. And It has been a great honor to be a part of this process. I know the work is not nearly finished, but we're here. We want to be supportive, and we want to get everyone back as safely and as quickly as possible.
Thank you so much, Sheba. One thing that I really appreciate about the work that you're doing is, as you said, you sort of have DHS on one side, right? And our public health officer who will have sort of very broad guidelines and requirements for businesses to reopen. And then you have a lot of small businesses who don't necessarily know exactly how to implement that in their own space. And so I see your role as really being that glue between those two different entities to provide that kind of best management practices and protocols for them to be able to implement the broad health guidelines, right? In whatever it is, if it's their little local bookstore or, whatever their business is, to make sure that they know what tools they need to be safe and to keep their employees safe and keep their customers safe.
Yes, absolutely. Yeah, absolutely. And we are through the county, as you know, are trying to source some of those PPE requirements. And so we're working, trying to pull some of those resources in to be able to make those available. So whether that's sanitizer or face coverings, we are working to try to source some of those to make those available to the community.
That will be so critical for small business owners. I've heard a lot of people who are just struggling to figure out where to source those critical supplies. And so if we're able to, as government, warehouse that and pass it on at cost, I think that's going to make a big difference to a lot of small business owners. Peter, I feel like there has been this sort of sometimes seems like an epic battle where you're pitting public health against the economy. And I know that you don't buy into that narrative. And I'm wondering if you can speak a little bit to that and why it's important that business work in concert with public health going forward. And sort of what was the impetus behind you, staying up late at night, waking up early in the morning, working with a whole bunch of folks to try to develop a framework that would integrate public health in the business community?
Thanks, Supervisor. I really do feel like that's a bad frame for everybody to use, health against business or business against health. And I realize that it's a really good soundbite. It's kind of provocative to say we're going to shut down and for public health, and let's just face it, that's bad for the economy. But I really echo sentiments that have already been expressed already. Certainly, Dr. Cunningham's. And some in your opening that it's really about the two working together for the betterment of the community. And let me kind of go at this in two different approaches. The first is, I have friends in New York, and let me tell you what's bad for business. Temporary morgues on the outside of hospitals where our ICUs are overrun with the virus, and it's out of control. That is bad for business. That is bad for us as individuals. It's bad for the economy. So I agree that the health officer took just absolutely heroic actions to very early on make a bold choice. And I agree with Dr. Cunningham that making such a bold choice saved lives. And so absolutely critical, and there's nothing bad about or in opposition of the economy in doing that. Let me take the other approach to this as well, to say that now that we have saved lives, now that we have taken all of the sort of owner's personal responsibility for attacking this virus collectively, we also see that public health and the economy are linked beyond just the virus. And when I was in the health department, did a lot of work around social determinants of health, and of course, income and the economy are key drivers to that. Not just through the increased rates in adult protective service cases and child protective service cases that are going on right now. But nationally, we have nearing 30 million in jobless claims, or unemployment claims. We have tens of thousands over the last couple of periods in unemployment claims locally, and all of that reflects on food insecurity, housing insecurity, issues that really impact people's health and getting to the point of even a person's lifespan. And so when the economy is bad like that, it is also bad for public health, right? And if we don't take proactive measures to protect the public's health, then it can also be very bad for the economy, right? So through those two lenses, that's why I say business versus the economy is absolute bunk. And it's really the two working together. And of course, as we are looking to open up or reopen businesses, we also need to make sure that people working in those businesses are safe and secure and sound and well taken care of. Because if we don't, then again, that is harm again on the overall public's health and cyclically back onto the economy. So I appreciate the runway to kind of expound on that question a little bit, but that's why I see the two in partnership, and that's why I'm so committed to partnering with the medical community and our small business community.
Thank you so much, Peter. I think that I know that you have firsthand experience at the Santa Rosa Metro Chamber, the heartbreak of hearing from businesses who are potentially shuttering their doors, not just temporarily, but maybe forever, right? Where they don't think that they're going to be able to reopen. Do you want to share just a little bit about the resources that what the chamber has been doing to support its members? And then I have the same question for Sheba, because I know that her team, in addition to working on the future reopening, has also been working around the clock in terms of trying to provide real-time resources to small businesses.
Yeah, thanks so much. Certainly, if you go to the Chamber's website, there's a list of resources. A lot of those resources are mirrored on the Economic Development Board's website. We try to keep in close coordination on what federal and state resources are available. I think what you're referring to is our mini grant program that we put together in partnership with the Community Foundation, Bank Marin, Poppy Bank, and some anonymous private philanthropic donations as well. So we provided $2,000 grants to any small business in Sonoma County, regardless of their affiliation with the chamber. Small business defined as 20 or fewer employees, which coincidentally represents about 89% of businesses in Sonoma County. And so we would get responses. We still get responses back from recipients of that money, indicating it's the only resources that they've had for the last month and a half. And for some of them, they are purchasing food for the first time in many weeks, making good faith payments on rent and utilities that are becoming late. So the impact that we might expect over a duration when we see sort of an economic decline, we're seeing in such a compressed time frame right now. And people are really hurting.
Thank you, Peter, and thanks for stepping up and providing those grants. I know a number of West County businesses got them, and I really appreciate that. Sheba, could you speak to what the EDB has been doing in the meantime to try to support our small businesses in our community?
Yeah, absolutely. So we've been working on recovery framework, I would say, since the first week of March. And so it's really been that short-term, immediate approach. So how do we get people back ready to open? And then some of that long-term planning. So looking at a long-term strategic recovery plan, because we know that this is not an acute situation. We are definitely experiencing acute symptoms and impacts right now. People are hurting. This is a major problem, the biggest economic crisis that we've ever seen during our lifetime, but there's going to be long-term implications as well. And so how do we think through that strategically and be intentional about that work in the long term? We're also really collaborating with our partners in government to create policies that get out of the way. And so what I really mean is, if you have a business that's been closed for 7 weeks, when it's time for them to reopen, reducing the regulatory restrictions, making it easier, making it streamlined, thinking about permitting, thinking about fees, thinking about inspections, eliminating as much of that as possible so that people can just come back in, get back to work without those impediments that might be barriers to them. We're also working really, really hard on business assistance. And so basically the staff is working 7 days a week. There's a tremendous amount of people who are calling and emailing, trying to figure out what sort of resources are available. what's coming out of the federal government, what type of grant programs are coming out through chambers, as well as other sources throughout the state. So helping people walk through and navigate, how do I just keep my doors open right now? What sort of things do I need to take into consideration, and what sort of resources are available? So all that information, the resource recovery guide, all that information is on EDB's website. We're also, like Peter, we're also working on a stabilization grant program. So we've been trying to stand it up and think that we'll have that ready within the next few weeks. You know, Peter and I talked about it a couple of weeks ago, that there could never be enough available to really help businesses. And so anything that we can do, any way we can partner, tap into philanthropic dollars and others to bring grants to the public and to the business community is going to be critical. So there's lots of different things happening. I'll also say we knew early on that we would need to take a comprehensive look at the overall economic impacts, because it's going to be unprecedented, without a doubt. And so we are partnering to do an economic impact study. We did, of course, you know, we did a snapshot preview of that this past Tuesday, but we are actually looking at a comprehensive economic impact study that will probably be ready by the end of the summer, as we see how things evolve over time.
Thank you so much. And if anyone hears some strange noises in the background, that would be the Forestville howl that happens at 8 o'clock, which is also joined by my 1-year-old howling for a totally different reason downstairs. You know, we're seeing some of the questions come in, and I think that there are a lot of questions about the local health order and the state health order and essential versus non-essential businesses. And this is something that my colleague Supervisor Rabbitt has really taken a very keen interest in, and I have as well. And I'm wondering if, David, if you might take the opportunity to explain some of just the way that government is sort of broken into different levels at this point in time, and why there is this distinction between essential and non-essential businesses.
Yeah, no, I think that's really important for everyone to kind of grasp, and you can hear the howls here in Petaluma as well. You know, the federal government offers guidelines. The states have orders. The order in California, can you imagine, has to cover everything from Alpine County, which is what, 1,100 total residents, to Los Angeles County. So it's pretty broad and sweeping, not a lot of specifics. And then what's left to the individual county health officer is then to enact a local order that is enforced at the local level. One of the things that Supervisor Hopkins and I have been trying to champion a change on has been the definition of essential versus non-essential. And one of the more frustrating things is that some businesses were considered essential from a master list out of DC, while others were considered non-essential. And I know that Adam Kovacs, for instance, who I believe owns some fitness facilities and feels that he can implement all the mitigation measures going forward. The problem, I believe, is that he has a non-essential business. We've been trying to get the state to look at that differently, to really go to a risk assessment approach. And we believe that's the better way to go. We realize it's probably a little more complicated in terms of the activities that take place in all the different occupations and activities that Californians are involved with. But I believe that they are very open to it. And I would even say that they want to move in that direction. And I hope that they change that soon, because many times we'll come up to this question of wanting to see if a business can go forward with proper mitigation, but it's not an essential business. Therefore, the state order takes precedent, because that's what really happens is the state takes precedent over the county, especially if it's a more restrictive clause, or the county can take precedent, but only if it's more restrictive. So if you want to lighten things up, you can only lighten things up to the level that the state is comfortable with. And it's an ongoing question, ongoing dialogue. And I know that our 2 state senators here in Sonoma County and our assembly members are very much aware of that. We've had discussions with them going forward. And it really does kind of get into the weeds of how businesses are operating or not.
Thank you. And you know, that I kind of would like to ask Dr. Cunningham to speak a little bit to high transmission risk activities. And I know that, you know, you've been in conversations with Dr. Mace and that there were guidelines that were provided to the EDB. And I'm wondering if you could just sort of share what makes an economic activity higher risk or lower risk? Are there different metrics? Are there different categories that we can discuss?
Yeah, I think this is actually worth saying too, that you don't need a medical degree to figure out this disease and how to become safe. And I think that's really important for us to talk out loud, that The things that I do to keep myself safe when I see patients, that my staff do, that they do in the hospitals, are the same things that you're doing to keep your family, the same things that my wife and I are doing to keep our family safe. And that is that we have very good personal hygiene, that we wash our hands regularly, and that we use hand sanitizer. This virus is very susceptible to that, and that we don't touch our face on a regular basis, and we're careful about that. And the physical distancing matters. It's a respiratory droplet. It doesn't float through the air for long periods of time and hang out there like measles or other things. For the most part, it drops to the ground. So being 6 feet apart makes a difference. And if you're not able to be 6 feet apart, then you need to wear a mask. And I think those things are things that we all, no matter what we're doing as an individual or as a business, need to be put in place. So we should be assuming that we're going to have physical distancing, wearing a mask, hygiene and sanitization processes in place on all businesses until we have a vaccine. And I think we need to settle into that. So when you have businesses that are not able to have 6 feet of separation physically, that's a higher risk business than if you have a business that by definition is separated. If you're in a business that has multiple individuals congregating in a small space, that's a higher risk activity than if you're able to have flow that decreases the number. And that's not just economic, that's the same thing for my son's soccer team. They can do individual activities one-on-one a lot before they're going to go on to do matches. Those are things that we need to take into account. So as we're talking about risk mitigation, we're talking about safely opening up activities that we know can physically distance with small numbers of people coming in and very little contact between individuals moving forward. When that's safe and we can understand that it's safe over time, then we need to move on to more individuals, more congestion of the space, and being able to provide resources for that. So I'd like to try to keep it as simple as possible. Hygiene, physical distancing, and being able to have space that allows for that. So if that makes sense.
Dr. Cunningham, maybe I can ask you for a follow-up. Can you talk about the importance of testing and how that relates in everything that we're doing going forward? You mentioned the numbers that we're trying to achieve, and with the 2 state sites, one here in Petaluma, that'll give us, I think, at each one another, well, total of 264 a day, which is a great number, but we're trying to get to that 600 to 800 a day, the duration of that, the data set. And can you go into that for us?
Yeah, and Dr. Mace has put out a very compelling kind of projection for this next phase. If we do nothing, if we go back to, business as usual, we don't do physical distancing, we don't wash our hands, we don't have these kind of measures in place, we will see another spike. It should be assumed that we will see another spike. If we're able to test quickly and we're able to understand those who are asymptomatic, identify those who are asymptomatic and isolate them, we will be able to flatten the curve. So the current state is that we want to be able, within 4 days, but really within 48 to 4 hours to 4 days, we want to identify somebody who's symptomatic as COVID positive or not. And then we want to make sure that they're isolated. That's the most important thing. And then we want to do these what are called surveillance testing. We want to actually go into the community when they're not symptomatic and try to identify 20 to 30% of the individuals that may be in the community that are COVID positive. They're just not showing symptoms. And if we can do that within 4 days and we can do 20 to 30%, the bump will be out small. It'll never overwhelm our system, and it'll be way past the time that we can probably have a vaccine in place. So I think that that's an important public health collective action. When you're symptomatic, get tested and make sure that you're participating in these broad surveillance testing. And the capacity needs to be in place to then isolate. So those people who are waiting for their testing, or for some of our patients, for instance, when they're told they have to have their own bathroom or they have to have their own room, maybe they don't have their own bathroom or they have their own room. So the alternative care sites that are set up at Sonoma State are a really critical portion of this. Can we allow people to safely isolate in a place that allows them not to infect others? Almost all of the positive cases now are between those who are positive and their immediate contacts. So we now have systems in place to be able to test while they're waiting, to isolate if they need to somewhere else, and then to be able to act on it. So being able to have those, not only be having access to the testing, but the collective action or collective will of our population to be part of that solution is what we need to have to move forward.
All right, and I have a question from Tony about, as we carefully make plans for reopening, how are we assuring current frontline workers are safe, and how are we meeting those needs? And so questions about the accessibility of N95 masks noting that it's important to talk about how we are already supporting current workers with the same energy that we are talking about reopening stages. And unfortunately, we do not have our sort of emergency operations center folks on the line, but I do know that we have been continuing to source PPE through the county, through the General Services and Emergency Operations Center to try to get large quantities here locally, which we can then distribute to our various healthcare providers. And I don't know if Sheba or if Dr. Cunningham can speak any more to that. I know that Sheba's been more working on the sourcing for future supplies. Dr. Cunningham, do you have anything you want to add?
I guess I would just be honest and transparent a little bit too. When, as a frontline worker or as a nurse in a hospital, when we start saying, let's open up, there is fear there that we're being put at risk with increasing numbers. And so I think that is a statement of reality, and we need to make sure that we're actively procuring these N95 masks as a county, as a central organization, and making sure that we're undermining the siloing of our different organizations. So the positive thing is Sonoma County has history of working together across silos in a way that I feel very proud of. And as we act as a community, we can have purchasing power. So this is where each organization, I feel comfortable, is making those decisions appropriately, but we have some room to go to make sure there's not disparity across the organization. So I don't want to undermine the concern that people have with PPE, just to know that that's not being poo-pooed, that's not being undermined moving forward.
I think there's a question for Sheba that we can go to and talk about, again, I mentioned it, but the essential business versus the level of risk and mitigation potential with social distancing and advanced hygiene. And I know that you had just sent out a lot of information to businesses, Sheba, this past week. Can you talk about what that looks like going forward for those businesses that right now are considered non-essential, but hopefully once the state backs off on that, will be allowed to actually get back into business with the mitigations on hand to make sure that we don't sacrifice any public health?
Yes, absolutely. So that's a great point. We do anticipate that the framing of that, the categorization of essential versus non-essential will change, hopefully sooner as opposed to later. And we know that if a business is coming back online, that to Dr. Cunningham's point, as long as we could continue to think about those fundamentals, how do we distance ourselves, the person-to-person contact, trying to limit that as much as possible, thinking about the layout of your operation, whether that means, I saw someone in the chat ask about, can we move some of these things outside? So if I'm a restaurant, can I start to move some of my tables out onto the sidewalk to allow for some of that? If I'm a retail establishment, how do I think about those things and move some of those things out into outdoor spaces and think about street closures to allow for pedestrian throughways to, again, promote some of that distancing? I do think that we do have a lot of very hardworking, responsible owners and operators out there who really, really want to do the right thing. They want to do the right thing for their customers and patrons, as well as their staff and employees. They want people to have confidence that they are coming into a safe environment. And so what everyone, I think, is really thinking through right now, well, how do I do that? How do I think about my store layout? How do I think about my restaurant layout? How do I think about hand washing stations and sanitizer and PPE and facial coverings, and to make sure that those things are sourced and available? Because all businesses is truly essential business. If it allows me to earn a living and support my family, then that is essential. And so thinking about it in a very comprehensive, thoughtful way, reducing the person-to-person contact, promoting the distancing, making sure that we have really great hygiene. And also, I don't think we've talked about it to a great extent, but making sure that there is clear communication between me as a boss or operator or a manager or whatever that role might be, and the staff, to be checking in with them daily, so that if they are exhibiting symptoms or if they've come in contact with someone that they think is COVID positive, then they need to be referred to their medical professionals and not bring that into the workplace. I know that people here are really good actors, but what we have seen clearly in other parts of the country is not everyone have been good actors. We have seen work environments where people were encouraged to not miss a shift, right? So making sure that there's that daily communication with the staff and management that everyone is comfortable coming into that environment, and that if something is amiss with their health, that they don't report to work. I think is going to be really critical, because that continued testing is going to be so important to look for what are the indicators and how are we doing as we reopen, as more and more people come out, as more and more people go into the stores, into the restaurants, and get back to manufacturing. Continuing to monitor that in real time is going to be critical.
Thank you very much, Sheba. And a quick follow-up for actually both you and Peter. I know that it's very grim, obviously, right now for a lot of small business owners, but are there potential creative avenues that could help small businesses reinvent themselves? Do you see any hopeful strategies? You mentioned the idea of outdoor restaurants, and I'm wondering if maybe each of you could just provide something that would give people a little bit of hope, that's thinking, oh my gosh, I don't know how I'm going to restructure my business, but maybe if government did X, Y, or Z, or if I were provided with this type of support, that it would actually help me get back on my feet. So if you have any thoughts to that, maybe I'll go to Peter first and then back to Sheba.
Yeah, I really appreciate that question. It's one of the reasons why we've been arguing since day one that this essential versus non-essential shouldn't be in place, right? And we should just have the health standards that we all need to live by, because it would allow a business to figure out how to meet those health standards and stay going. Some great examples. So let's just use one that we already know of. Restaurants that had never done takeout or delivery, within 24 hours started up a delivery and takeout option. Within a couple days, ABC laws changed, and you can now pick up beer and get cocktails delivered to your house. My neighbor owns a bike store. He up until this recent order, he wasn't allowed to operate from his storefront. So he shifted his business that had no online presence at all to delivering bicycles. My internet connection looks like it got a little shaky there, I'm sorry. And there are other examples of that, of people shifting their entire business model to doing delivery and online retail, as well as health and wellness businesses moving to Zoom classes and that type of thing. So I think that there's a great opportunity here for business to reinvent, and it will need to. Going back to what Dr. Cunningham was saying, we are going to be in this for quite some time. And even as we reopen, that doesn't mean reopening back to normal. It means reopening to something else. It's just getting those standards in place so business can have a chance to figure out what that something else is.
Yes, and so in addition to what Peter talked about, there's definitely a lot of people who were able to augment and change very, very quickly and be very agile to think about their business service delivery. We have seen a tremendous amount of people venturing into e-commerce that had never thought about that before. How do I do online? And so that's been really creative. We also have seen a lot of people quickly shift their operations to meet the current demands. And so there were companies who had never made hand sanitizer, for example, who quickly shifted their manufacturing to meet the current need and future needs and demands, because they saw this is an opportunity. I can quickly be innovative and creative and think about my business and how do I continue to thrive in this really uncertain time that we're in. So we've seen a lot of that innovation. We've seen companies going into things like sanitizers, things like PPE that never had done that before. Thinking about how do they bring things onto line that are relevant. So if there's any bright spot out there, is that being in a crisis, being in this type of situation really does force innovation and creativity. And we have a great deal of really creative people out there who are bringing incredible new products and resources to bear that didn't exist before. And so I think particularly in medical devices and in that area, we've seen a lot of that happen. Also, we've seen people go to 100% virtual format, just like Peter said. So how do I think about the way I operate and how I service my customers. And can I do that in a virtual world? Do I need a physical space? And there have been some people who've been very successful at doing that. Thank you.
Thanks, Sheba. And I think I know of 2 small distilleries here in Petaluma that used to make great gin and whiskey are now making great hand sanitizer, both at Griffo and Barber. So very appreciative of the work that they're doing. And they're actually getting it out to many different businesses and first responders out there. So that's wonderful. I want to go back and just talk real briefly again about how the state order influences what we can do here in Sonoma County. You know, and I believe there was a meeting not that long ago, excuse me, up in Sacramento with 4 members of the governor's cabinet, including the Department of Public Health Director, Dr. Sonia Angel. And that's where the conversation regarding essential versus and non-essential was really, and at that time, they were actually thanking the counties for bringing forward this safe, less safe terminology to really kind of go through that. We can think of, no doubt, dozens of different types of businesses that there's very few human-to-human contact about the way that it goes forward. One of those that we actually included in this order going forward is florists, for instance, where you can take orders by phone or through internet. You can deliver flowers to a doorstep and quite frankly, not even see another human being that way. And with Mother's Day coming up and the vulnerability of all small businesses, we totally get. So looking at those businesses that really, truly can operate at a very low risk is something that we really want to concentrate on. Because if we can get those people back to work, you know, quite frankly, it's going to be a while before there's mass gatherings and large events. And that's just the way it is, because I know through Dr. Cunningham that it's really about, you know, it's about the proximity of the contacts, the number of the contacts, and the duration of the contacts. So everything that we can do on the mitigation side to mitigate those things, to make it safe for everyone, is going to be wonderful going forward and allow some more businesses to open up and to, again, to do it in a very safe manner. Supervisor Hopkins?
Yeah, thank you. You know, I've got a question queued up for that I think Dr. Cunningham might be able to answer. But actually, before I jump into that, I do want to add on to what my colleague David said. You know, it's very challenging when we have multiple sort of health orders that we're in compliance with. And the way that the governor has broken it down is he has phase 1 and phase 2 and phase 3 and phase 4. And so his announcement last week was that we would be entering phase 2 as a state within a matter of, quote, days, not weeks. So I had a number of questions come in via Facebook Live regarding timeline. And unfortunately, we don't have a timeline because we have both our local timeline, which will be ultimately controlled by Dr. Mace and made based on our locally available data, our local capacity for testing. But then we're also sort of under the state timeline. And so the phase 2, as I understand it from the state, will actually allow retail to come back online. There aren't a lot of details yet. We don't have, you know, details in terms of what types of retail, you know, what types of manufacturing. Retail and manufacturing are 2 of the things that have been cited frequently. And again, we are being told days, not weeks. But that's obviously not a specific timeline. And I recognize that there are a lot of folks who want more information, and unfortunately, it just isn't available. And actually, oh yes, David actually wanted to jump in and say something about the date as well.
Yeah, no, I appreciate that. And thank you very much. I think, you know, this is the first order that we've put together that does not have an end date. And I see that as a positive because I think it makes this order much more nimble, that we can really look at, unlike probably in 2-week increments, making adjustments, either tightening up and ratcheting down if the numbers go in a direction that we don't want, or if we stay below that magic threshold, we can loosen a little more as we go forward. What's been true of the orders that we have had in date or had in place previously had end dates, and those end dates were really they really were arbitrary. We had no idea what was going to be different on that day. We were just putting a date out into the future, 30 days or so forward. This aligns with the state by not having an end date. I know that some people think that is a bad thing because we don't know when the end of this is. Well, the virus, as Dr. Fauci's always said, the virus has its own schedule. We need to do everything possible here locally to be prepared and to combat it and combat the spread, which we've been doing. And that allows us then to get to that next step, that next phase, of actually being able to open with proper mitigation, but keeping our eye on what's happening health-wise, that we can do that responsibly. So I actually think it's a good thing that we don't have an end date on this order, because it does allow us to be a little more nimble as we go. And hopefully, again, that means we can loosen things in the near future and not in the far future.
Thank you. And I agree wholeheartedly. I know that some people saw this and they honestly panicked to see that we had a public health order that didn't have an end date. But the fact is that this means that we are going to be evaluating the local data and the local capacity every single day, every single week, and adjusting as necessary. Whereas, we all function around deadlines, right? So if this order sunsets in a month, guess what? It's not going to be re-looked at until very close to the end of that month, because there's already been sort of a framework in place. So I really do believe that this means that this will be a constantly evolving living document. And I know that Dr. Mace is tracking the data incredibly carefully to be able to make adjustments and loosenings potentially as necessary and as they become sort of feasible with respect to the public health and safety of our entire community. Question for Dr. Cunningham. There's been some questions that have come in regarding antibody testing, and I'm just wondering if you could share sort of what you know about antibody testing, if that's something that might prove useful for reopening the economy. How reliable are these tests? Just anything that you could share to educate us.
Yeah, great question. And I think the answer is we don't know yet. There's a couple competing problems here. One is the validity of the tests. So there are many, many different tests, some FDA approved and some not. There are different types of antibodies. Some give us insight into a long-term immunity, something we had exposure many months ago or even weeks ago, versus right away, within 2 to 4 days, are you being exposed? And those have different sensitivity and specificity. We have different understandings of how valid those tests are. And then the question about what do we do with that data? So if I'm immune, how immune am I? Does that mean that I can go out and do any activity I want without having a risk? We don't know the answer to that. How long is that immunity give us? If we open up that positive, IgG, which is this long-term immunity, will we have people change behaviors in a way that's not appropriate? So at least for us in our practice at West County Health Centers, we will be using the antibody testing that are available in the commercially available labs that we trust. But we're going to be very careful about how we use them. And so as of right now, to me, it's not part of the solution, but it will be in some way part of the solution moving forward.
Thank you very much for that information. Now, our time is growing short, so I just want to ask the last question for Sheba, and then offer everyone just a minute to make any closing comments, any last thoughts that you might want to share with the audience tonight. So Sheba, we've got a number of questions. Gym, salon owners asking how they prepare for opening and who they talk with. So where should they go, after this town hall to get more information, to get access to those BMPs as soon as they are available? Where should they connect?
Yes, absolutely. So sonomaedb.org, the BMPs will be ready, we anticipate, by Tuesday or Wednesday. We at the government are not developing those. Industry leaders and business owners are developing those, because it really speaks to how their operations will work and what is the most feasible, practical, easiest way for people to comply. We know they want to comply, so that's where all that information will be. The overall mitigation, those 3 high-level mitigation measures will be posted as well. That way everyone, for full transparency, will know these are the 3 things they need to be thinking about. But I do think it goes back to what we've heard Dr. Mason, Dr. Cunningham say. It is really good hygiene, right? So are you going to put in a sanitizer station, a wash station? How are you going to try to separate people as best as possible? Do you need to be thinking about plexiglass to put some sort of barrier between your cashiers and your patrons? And those are the types of things that people need to be thinking about with respect to their individual operation and how they're going to be able to meet those criteria, specifically around creating some distance and promoting really great hygiene and making sure that we have some PPE for staff as they come back into the workplace. We want them to feel comfortable.
Thank you so much. And then with that, we will do sort of a lightning round of closing comments, starting with my colleague, David.
Oh, again, thank you very much for the conversation tonight. And I think, what's true, and Dr. Cunningham, correct me if I'm wrong, but health orders are going to be with us for a while. They're going to look different as we go forward. I'm hoping, again, with all things considered, that our numbers are going to continue to stay flat and that we're going to be below the healthcare capacity of the county. But there's still going to be, those people that are going to be vulnerable need to take precautions, that there'll still be social distancing and the hygiene and everything else that we've learned through this process until the virus is totally under control. And that really means, I assume, a vaccine. And that is going to be our future. So businesses are going to operate differently, and we're going to be a different type of customer. We're just going to have to get used to that. And I think that we can. And I do think that our businesses are up to it. And again, I appreciate the fact that in this county, at least, as opposed to some other locales around, that we're really taking this measured, responsible approach, that we are trying to push, and we recognize the hardship of folks who have been without that paycheck or whose businesses are really hurting. But we need to make sure that we're doing the right thing on health, and we need to make sure that we don't have that dreaded second spike that could even be worse than the first. And I know that the longer this goes on, the more we'll learn about the virus. That'll be helpful. I know that people are working around the clock right now, really throughout the world, on the virus, looking for a vaccine. My wife works at UCSF, and I think they have 14 separate clinical trials right now on COVID-19. And that's only one of a multitude of university research hospitals that are around. So it is a full court press. We need to continue to stay the course. We need to continue to push with our state partners to make sure that we're doing the right thing. But we need to make sure that we are all prepared going forward, and that our businesses are prepared to open and to gain the confidence of their customers as well, as not only protect their health, but gain the confidence going forward. I think we're up to it. And I'm optimistic that over the next course of a couple of weeks, I hope we'll see even more relaxation, hopefully, if our numbers stay where they're at now. So again, thank you for the conversation tonight. I really enjoyed it.
Thank you very much, David. Really appreciate all of your advocacy for science-based, data-driven approaches, because at the end of the day, that's what we can justify to the community, right? We recognize that people are making sacrifices. We need to be able to tell them why those sacrifices are being made, and also what the results are of those sacrifices on, just a fundamental level with respect to reducing transmission risk. Dr. Cunningham, speaking of that, any final words of wisdom?
No, just, to say again how proud I am of what we've done so far, and how confident I am that we can take this on moving forward. But that's going to take courageous, transparent leadership. And it's also going to take a collective action. So I think it behooves us to make sure that we all take this on individually, and that as business leaders, but also as individuals, we take this seriously, and that we're able to move forward with this. And then I think we'll look back on that to say that we've really done something over the next couple of months. So I do want to say thank you for this, I think, as an example of that transparent leadership. So
thank you so much, Dr. Cunningham, for participating, and thank you for all of your fantastic work keeping the West County residents healthy. Your work is tireless, and I really appreciate that. Peter, what would you like to share on behalf of the Santa Rosa Metro Chamber? Advice, hopeful inspiration to your members and all the small businesses that we know are struggling right now.
Well, I would want to first close in gratitude to you, Supervisor Hopkins and Supervisor Rabbitt. I appreciate you making the time and inviting me on. Appreciate everybody for tuning in as well, and listening to us and asking the questions. I guess I would say two things. The first is, I'm a husband, a father of two. We are doing schooling throughout the day, just like everybody else. My own organization, we're going through some pretty difficult times as well, just like every business in the community. So, I hear you, and I recognize how difficult it is. And just know that I am here. The Santa Rosa Chamber is here, both for the community as well as for our members. We understand, and to echo Dr. Cunningham, we're in it together. And I've seen our community rise through fire, flood, fire, and power emergencies and other things as well. And I know that we will be able to stay together and make it through this.
Thank you so much, Peter. I always say we've been through hell and high water together, because it is literally true. And it's a really tough time and a really tough moment for our community. And I want to acknowledge that. But I also want to say that the people who are on this panel are the reason that I have hope for this community, because every single one of these folks is working 24/7, trying to get this community back on its feet, trying to make sure that our businesses have the tools and the resources that they need to reopen. And so I would like to hand it over to Sheba for the final words, because she is truly one of the bright lights in leadership in county government, and the passion that she brings to her work is felt by everyone, quite frankly, who comes into contact with her. And I know that it's something that she's losing sleep over, thinking about how she can best serve the business community, how she can take care of some of our most vulnerable businesses, whether those are already in disadvantaged areas that we're struggling to begin with, looking at the hardest hit industries, such as the restaurant industry and the tourism industry. So Sheba, share with us your final thoughts.
Absolutely. Thank you so much, Supervisor Hopkins. So I would just say this is definitely a collaborative effort. There is no one entity out there that's going to be able to get us to where we need to go. So EDB is really working to be that bridge between the Department of Health, economic development professionals, business development professionals, and industry to really advocate for them, to rally on their behalf, to help them understand and help them comply. We know that people are savvy. They're dedicated, they're smart, they know how to get there, but they need some help. Everyone needs some help. And so we want to be that resource. We're here to serve. SonomaEDB.org. Reach out if you have ideas. We welcome them. We want to collaborate. We want to partner. We have staff that are working 7 days a week to really bring that to bear. And I will just part by just saying that we know that government has a role, and it's an appropriate role, but business also has a role as well. And part of government's role is knowing when to step out of the way. So whether it's looking at sidewalk easements, whether again it's looking at fees and how to mitigate those, how to streamline processes, how to look at things in a comprehensive, common sense approach to make it as easy and as seamless as humanly possible, to allow people to come back online in a safe way. So we're working really, really hard on all of those different things.
Thank you so much, Sheba. And I want to say a thank you also to every single person in our community who is, some people who are working tirelessly around the clock, in addition to all of us, whether they are a healthcare worker, whether they are, an essential worker, making sure that we all have food, making sure that we're all able to conduct basic repairs, make sure that our houses stay running, make sure that our roads stay running. It's going to take every single one of us to get through this pandemic. And so thank you for doing your part, whether your part is showing up to work despite the pandemic, or whether your part has been staying home and taking that financial sacrifice. And we will be working for all of you, whether you are an essential worker, whether you have been sidelined, to make sure that you have the resources that you need to get back on your feet. Take care and be well, and good night, everyone.